Good afternoon, everyone. Welcome to TeleShadowing. We are live on YouTube. Please feel free to ask any questions you would like in the chat box as we go along, and they'll be addressed at the end during our Q&A session. It is my honor and privilege to introduce Dr. John Greene. Dr. Greene earned his medical degree from the University of South Florida College of Medicine in Tampa, where he also completed both his internal medicine residency and his infectious diseases fellowship. Today, he serves as a professor of medicine and is the section chief for the Division of Infectious Diseases and Tropical Medicine. He is also a senior member of the Internal Medicine Department at the Moffitt Cancer Center and serves as the chief epidemiologist and director of employee health. Dr. Greene is a highly accomplished researcher and author, having published over 230 manuscripts in peer-reviewed journals and more than 150 abstracts. His primary research interests focus on the prevention and management of infectious complications in neutropenic patients, as well as the diagnosis of non-tuberculous mycobacterial infections. Throughout his distinguished career, he has received numerous honors, including the Outstanding Resident Teaching Award and the Outstanding Teacher of the Year Award from the American College of Physicians. On a personal note, Dr. Greene has been a dedicated mentor to hundreds of students, including myself and my mother, as I begin my own journey into medical school and continue it. And his commitment to service is further seen in his annual medical mission trips, where he brings students with him to provide care in developing countries. Now, please join me in welcoming Dr. John Greene as he begins today's session. Thank you.
Thank you for having me, and it's good to be back again. And I would like to share with you what an infectious disease doctor does for a living and how that career started, and how it's continuing today. So I appreciate that warm and nice introduction. So if you could I could take you back to my early days. I was born, raised in Miami, and this is what it would look like there. I spent a lot of time at the beach, especially Hollover Beach, so it's fun out there. And we even have the Everglades down there, which was also fun. And then I went to high school at Hialeah, Miami Lakes. I played football. And while I was going there in the ninth grade, I had a major encounter. Hanging out at the beach, I met the guy they called Holy Joe, who made the newspapers. And there he is preaching his message to people. And that impacted me. And since ninth grade, I followed as a Christian believer, and it has helped me through my life with my strong beliefs in God and where I'm going and how to get there. I ultimately got a football scholarship and played for 4 years as defensive guard at William and Mary. I didn't necessarily start, but I did my pre-med there, and it got me through learning discipline and hard work on the campus where Thomas Jefferson even went. It was a nice place to spend 4 years. And then I applied and got into medical school. And the medical school now is in downtown Tampa, and you can see it there to the right. It used to be right next to the Moffitt Cancer Center, right next to it before it moved there when I attended. After graduating med school, residency, fellowship in internal medicine, and then in infectious, I was 31 years old, and I was asked to run the infectious department at the Moffitt Cancer Center, which looks like this, and right behind it is the old medical school building where I went to school. So I've been here since 1982, long time. Now Moffitt has expanded to not only this building, but one a mile away where they have even more space. So I would like to show you as a infectious doctor, but also how to think intelligently, not just in your brain, but also it's very important to have, as a physician, a nurse or a nurse practitioner, physician assistant, is emotional intelligence. That is totally different than intellectual intelligence. So emotional intelligence is a part of your brain called the amygdala, is where you get your fright and flight responses. It's very tied into your emotions. So when you react in anger in an inappropriate way or other types of behaviors, it's because your amygdala is signaling you to behave this way, and you need to have self-control and control with the higher cortex, this brainstem amygdala that wants you to fly off the end, whether it's anger, fear, or other things. So you need to get self-control of that. There's books written about emotional intelligence, and that's very big in medicine. Now, I chair the ethics committee, and I'm going to give you an ethical dilemma that's a true story. And here's how it goes. The Pulitzer Prize winner that made the best picture ever published in the year that he did it helped to stop a famine in Sudan by taking a picture of a dying child who was trying to get to a relief camp just a kilometer away. And he spent an hour taking the photos with a buzzard or vulture behind him ready to eat him because he was so weak he couldn't make it. So he took the pictures and ultimately he left. And the famine was relieved as all the nations in the world saw his picture and they stopped. They sent in supplies. So it was because of his picture he won the Pulitzer Prize. When he was giving talks about his Pulitzer Prize, he mentioned about how he set it all up and then the whole relief system there. But when someone asked him a question, whatever happened to that boy, he couldn't answer it because he packed up his film and he left and did not do anything and didn't know what happened to the boy. Now, granted, he was told don't get involved with any of the locals and just let things play out the way they are. Nevertheless, it bothered his conscience, and ultimately he committed suicide. And when they read his note before he committed suicide, it said, "Dear God, I promise I'll never waste my food, no matter how bad it can taste, how full I may be. I pray he'll protect this little boy, guide, deliver him away from his misery. I pray we will be more sensitive towards the world around us and not be blinded by our own selfish nature and interest. I hope this picture will always serve as a reminder to us how fortunate we are, and we must never take things for granted." Now, you can Google and Wikipedia this story, which is about compassion and why we need to be thinking outside ourselves and be more other centric. That was the famous picture, by the way. And if you Google it, they actually thought it was a girl, but when they investigated it, it was actually a boy. So read that, and you will be understanding how things in life can affect you dramatically as this story is told. And it illustrates this ethical principle of thinking of others and understanding what others are feeling and what their needs are and trying to help them. Now, whatever your religious background, when you're helping people with end of life decisions, whether you are non-religious or religious, you need to understand where people are coming from. Why would they want to do what they do when all the medical evidence means you should quit, go to hospice, and go to comfort measures only? And yet, a lot of people and family cannot accept that, and they ultimately allow someone to go slowly and painfully to death, coding on the ventilator with dialysis in the intensive care unit. Why would anyone want to do that? Well, you have to understand where people are coming from and how they view end of life, death and dying, and the afterlife. If you want a good read on it from an objective medical standpoint, check out The Lancet in 2005. It will cover whether you have an end of life story from a Buddhist standpoint, a Hindu standpoint, an Islamic view, a Jewish perspective, a Catholic perspective, or a Protestant or traditional Christian view. Or if you have no religious interest, or you're agnostic atheist, there's a end of life humanist view. And then ultimately, what motivates people when they die and what happens to them is what happens after death. And a lot of faiths believe in a future heaven, a future hell, a future judgment. All of those things are important to understand. Where is your patient coming from? In fact, If you finish med school in the old days, they may change this in the future, and even wherever you go to med school, you would have to do from nursing school the Nightingale Pledge, named after the famous nurse Nightingale. If you do the medicine pledge, you may recite the Hippocratic Oath, which I'm not going to cover. I'm just showing you how this is other oriented and not about yourself and being selfish. If you're a physician assistant or a nurse practitioner, you also will have an oath. And if you're a pharmacist, you will also potentially swear an oath. Again, all of these pointing to a higher call outside yourself, whether you believe in God or not. This social worker even has a code very similar. And then finally, just to give you an idea of why we can discuss these things from a pure objective, detached standpoint, you as a physician or any other medical profession have real people, real lives, real problems. So I'll illustrate it real quickly before I get into my lecture on the objective infection part. So this is a patient on the far left. That's her daughter and husband. She has leukemia. She gets a transplant. She has all kinds of infections and complications of the transplant, and the leukemia comes back. But her one wish before she was going to pass away is, God, please keep me alive, and so I can see my daughter graduate from college. Well, she gets her request, and her daughter does graduate from college, and she was there with her mask of protection. She needed a lot of steroids for graft versus host disease, so her cheeks are a little flushed and swollen, but she is still alive here. Her last other wish was, I want to go to the movies and actually see this movie that was coming out. And so the movie theater actually allowed her to come when she was feeling weak and tired in a special chair. And there she is in the movie house, again, getting her wish. I wanted to do those two things in life. She eventually passed away and has a legacy of a very strong testimony of living for others. And she pointed out all the medical people, from nurses, physician to everyone else, who helped her in the journey and helped her to reach her goals in life. And that's what it's all about. So that's the real nature of medicine, helping real people. Now let's go to the medical objective side of things, detached from the patient, but nevertheless, this is what patients can show up with. So I'm going to cover infectious disease emergencies, okay? So let's talk about encounters with animals. Now, these are going to be questions that are on every medical board question, general medicine and infectious disease, and this is common knowledge. You need to know this stuff. So if you have a dog and your dog licks your cut, as you can see there, or you get a dog bite, usually you will get over that and you may or may not need antibiotics. But if you don't have a spleen, your spleen helps to get rid of certain organisms that have a capsule and organisms that can be found in the dog's mouth. And you can develop a syndrome, which includes disseminated intravascular coagulation, where your skin gets very purplish and splotched and decreased blood flow. Your blood vessels can now clot up, which you're looking at, blood vessels with clots in them. The organism in the dog's mouth is a gram-negative filamentous rod growing in low oxygen called anaerobic. If you survive the low blood pressure, needing blood pressure for support and septic shock in the ICU, you will shut down peripheral circulation as if you have frostbite and vasoconstriction to your hands and feet. You will then potentially develop dry gangrene, where they will literally have to amputate your hands and fingers a month later as they separate the normal tissue from the dead tissue. Once it's black, it's not coming back. Okay? So remember, any part of your body can experience that, even the nose, and it's from the dog's mouth. Now, that doesn't mean you need to get rid of your dog. I'm just telling you, without a spleen, there's certain bugs that can be a problem. What is the name of that bacteria, by the way? If you like microbiology or not, it's a long name, but it has meaning. The bug's name is Capnocytophaga caenomorsus. If you broke that down, capno means CO2, phaga means eat. It requires CO2 to grow, so the name fits, Capnocytophaga. Caenomorsus is canine for dog, okay? So this is the syndrome of capnocytophaga without a spleen, or you're immune suppressed, and there's your dry gangrene if you survive. Now, since we're talking about these black and purple looking lesions and dry gangrene, let me give you another syndrome in a different patient situation. This lady has a history of lung cancer. She has this rash, which looks like dry gangrene of the fingertips, the nose tip, the cheeks, and the arm. She has what's called purpura fulminans. Purpura means bleeding into the skin. Fulminans means it's fulminating, it's quite severe. And whenever you see purpura fulminans, you want to think of bugs on the right-hand side, such as Capnocytophaga caenomorsus. Whether you have a spleen or not, it can occur. The encapsulated organisms that are also probable is pneumonia, like strep pneumonia, and the meningitis bug, Neisseria meningitidis. This lady had the non-infectious cause on the left, which is due to a paraneoplastic syndrome from her cancer, and it's her own immune system caused all this clotting and agglutinating and problems. In fact, the New England Journal of Medicine does a nice review on the whole syndrome of purpura fulminans, showing you these black hands and feet and how it affects the liver and the rest of the body. And if you get into the blood work, the platelet count on the red drops from normal to very low because it's all getting caught up in clotting. And if you survive, it comes back up in 2 weeks. Now, the other bug that can cause purpura fulminans is Neisseria meningitidis, causing meningitis, which your back is stiff as a board because of the pressure there. This is what you would look like semi-comatose with meningitis and a stiff neck. So meningitis and stiff neck go together. Your brain would have pus all over it and blood vessels dilated. You may have these petechial ecchymotic purpuric red splotches on your skin. And in your spinal fluid, you would see some neutrophils or white cells in the middle, and those infamous gram-negative diplococci, the smaller things surrounding it. And then you get the same syndrome that we've been harping on since I started, which is the purpura lesions, the dry gangrene, needing amputation in the future. So summing all of this up in one slide, this is it. If you don't have a spleen, you can get these encapsulated organisms and the one in the dog's mouth, Capnocytophaga, and you will be at risk of this for all your life, but especially if you lose it in childhood, and you may need to take an antibiotic like penicillin to prevent it until you're 21 years of age. And you need to be vaccinated for pneumococcus, strep pneumo, and Neisseria meningitidis, and Haemophilus influenza. So this is important to understand the spleen situation. Now, the second animal question is the cat family, the feline family, whether it's a kitten or that mouth has certain bugs in it, and this child may get a little bite. Whether it's a small kitten or a lion or big cat, they all have the same thing in their mouth, and they usually bite, at least cats do, because you're doing something with your hands. So the fingers and hands are notorious for cat bites. And because cats puncture with sharp, pointy teeth, their wounds don't look as bad as the dogs, which have the flatter teeth, but the punctures can introduce bacteria into your tendons, bones, and joints and cause an internal infection. Now, you need to know what bug is in the cat's mouth and in 60% of dogs' mouths. And the answer is named after Louis Pasteur, called Pastorella, and it's called multicida. Multo means many, cida kills many, bad species. Pastorella multocida. So a cat is much more likely to get infected than a dog bite. And the reason is of that puncture wound. So you would need antibiotics like augmentin. So we covered the dog, we covered the cat. What about the human mouth? The human mouth can get a bite, or you punch somebody in the mouth, their teeth cut your skin, and now you have an infection in the skin and the joint and even the bone. That human mouth bugs are anaerobic strep and gram negatives called Eikenella. The drugs that treat all bite wounds after a cat, dog, human, or any other animal is augmentin, amoxicillin clavulanate, or Unison IV. So augmentin oral. Now, if you have a pet rodent or you're working in a lab dealing with rats, and if your rat bites you, what is found in the rat's mouth? Well, you could actually develop rat bite fever, which is a syndrome of red rash, even pustules, and a bacteria in your blood that could actually kill you. What is the name of that bacteria? Okay, the syndrome is called rat bite fever. The bug is called Streptobacillus moniliformis. It's an anaerobic gram negative rod. And you treat it again with augmentin unison. Now, if you're in Asia and a rat bites you, you may get a different bug, which is more of a spirochete, and that one is called not Streptobacillus moniliformis, but Spirilium minus. Again, treat it with augmentin and unison. Now, we're still in the animal topic. What about a bat flying around your bedroom? What do you worry about if a bat is in your room? You're worried about getting rabies, right? And this is your neuron brain with those red little negri bodies, which is rabies infiltrating the brain, which has a close to 100% mortality. That's a close up of the red negri body. If you're in other countries, the most common cause of a animal giving you rabies is going to be a dog bite. If you're in the United States, depends on where you're at. The raccoon and the bat are most common in Florida. If you're in the middle of the US, it could be a skunk, a fox, or a coyote. And so, what do those animals look like? Well, you need to recognize what a skunk looks like, a raccoon, a fox, and a coyote. In the rest of the world, you want to know that it's the dog, okay? And the dog could bite you, and months, years later, you could get rabies, okay? So you want to make sure you get rabies immune globulin. The other thing you can get from a wound of any type, whether it's from an animal, a human, or a nail, or a trauma or puncture, is the locked jaw, where your jaw is in locked. It's called risus sardonicus, the sardonic smile for Latin. And then if you get into total body spasm, like this child with lockjaw, that's what it would look like with tetanus causing opisthotonus, total body spasm, and the sardonic smile of lockjaw called risus sardonicus. And that's a summary of what you could see. The cousin of tetanus, which is total body spasm, is the cousin called Clostridium botulinum for botulism. That's the opposite toxin that causes muscle relaxing. And the Clostridium tetani causes tetanus, which is total body spasm, losing your inhibitory neurons. So here's a lady with total body paralysis. She can't close her eyes, and she's heading towards a ventilator with total body paralysis due to botulism. You may not have an animal in that story, but I had it to throw it in with this topic. If you're a baby, you're always told don't feed a baby honey that doesn't come from a store. It could have botulism spores in it. And in the GI tract, the baby is a floppy baby, in other words, paralysis. And that's what baby paralysis from botulism would look like. And then, just like anything in medicine, infectious, it's good to know the pathophysiology of why things happen. And so, if you come to the nerve, the end of the nerve where it attaches to the muscle and makes it contract, you can see that the botulism works right at the end there, preventing the transmission of acetylcholine from the nerve to the muscle to make it contract. And this would be what the schematic would look like. So when you give antitoxin for botulism, you prevent the toxin from keeping the acetylcholine from nerve transmission. The sooner that you give it, the better. Okay, so that's the animal world. Let's talk about water-associated emergencies. So knowing what water we are in contact with and what infections can ensue and what risk groups would get it. So if you are exposed to fresh water, whether it's an alligator bite or a leech is on you, or you get a propeller injury with fresh water getting into the wound, or you decide to play mud football, which is fresh water with mud, or you decide to go to a mudathlon where you are exposed to muds with possible cuts. And what bug is found in fresh water with all of these activities? And you could die from it with a serious illness if you have low immunity or iron overload, which is found in people with liver disease, drinking too much alcohol constantly, having liver disease, whether it's alcohol or not, and iron overload. The bug is called Aeromonas hydrophila. Hydra, water, phila, loves water. Aeromonas hydrophila. Okay, that's the infection you'd get. Now, you could get a different bug whether it was fresh water or water mixed with salt water called brackish water. That second bug is called Plesiomonas shigelloides. And yes, it is found in Florida. The third bug makes more of the news than the first two when you're around water. So now we're going to go to salt water. And if you're immune suppressed or you have liver disease, whether it's alcohol induced or not, and you're iron overloaded, you can get a fatal illness with a bug that can get into your blood, into your tissues, and form large blisters or bullae on your skin and needing skin grafts. You can get that from salt water by eating raw oysters. Again, this is if you're a risk group. It's fine to eat raw oysters if you don't have those risk problems, because the same bug in the oyster is in salt water. If you're fishing in salt water and you get a cut, you can get this deadly illness with these blisters called bullae, the bleeding into the skin, just like purpura fulminans. And it's a curved gram-negative rod. And since it's in salt water, it grows on a media called thiocitrate bile salt. And this is what it would look like. And this bug is called Vibrio vulnificus. Now, this bug in the salt water is mostly in the summer warm months, and when hurricanes hit, such as Katrina and others, you will have water flooding with salt water. You will have people waiting in the water, and then you will have a few cases showing up more than usual, but not a lot, of people who are vulnerable to getting this Vibrio vulnificus infection, as you see here, that occurred after Hurricane Katrina. The Vibrio infections match the warmest months of the year in summer, such as July and August. So I have just covered several syndromes to you. I've covered the human bite, the dog bite, the cat bite, the salt water, and then the fresh water. The bug from the dog bite used to be called DF2, is now called Capnocytophaga canemorsus. Let's do topic number 3, pregnancy emergencies. So what do pregnant women get infection-wise? The most famous one is if they eat soft cheeses and other foods that can live in your refrigerator and grow because it's cryophilic. You eat it, you may not feel sick as a mother. You may have a mild flu-like illness. You may die from it, but most time you're not that sick, but you could have a miscarriage and your baby could be born dead or very sick. And what is that bug? That's a gram-positive rod, grows in the aerobic environment. It's found in your cold cuts, your ice cream, your soft cheeses, your unpasteurized milk, your cabbage, your lettuce, any type of food you can imagine. Cantaloupes have been implicated. It's a gram positive rod. It's beta hemolytic on the B section, which is just like staph and strep with beta hemolysis, with the little circle around the organism growing. The placenta can form granulomas, and you may lose your pregnancy. And of all the gram positive rods, which one do you think it is? The answer is Listeria. Listeria also can do special things that other bacteria don't, such as your midbrain right in the middle has those white spots, so it can cause an infection in the midbrain and the cerebellum down at the bottom right, and that controls your coordination. And then when you get infected in that part of your brain, we have a special word called rhomb, RHOMB, rhombencephalitis. And when you look at all the causes of rhombencephalitis, the top of the list will be Listeria, mono, Epstein-Barr virus, tuberculosis, and coccidioidomycosis down at the bottom. Here's a dead baby who was born with who was miscarried with and dead with listeria, with granulomas everywhere. It's called granulomatous infantum septicum. The skin looks like this. This is what the baby would look like from a schematic, as we just saw in that picture. The mother would be eating the soft cheeses, the cold cuts, the raw milk, the cantaloupe, etc. And what would be the outcome? So if you get infected in your first or second trimester, the baby will die 3/4 of the time, or you will deliver premature a quarter or half a quarter, an eighth of a time. Normal delivery is rare. If you get infected in your third trimester, the baby will likely not die, 3%, but you will likely deliver prematurely or have an abnormal delivery at full term. Now, the thing about listeria is it can live in your macrophages, which you're looking at here, and it can evade your immune system. There's the beta hemolysis. There's a semi-solid agar. You stab it in the middle with listeria, and it will migrate out from it, giving you the umbrella sign showing it has motility. Who's at risk of listeria? The very young babies, 1 year old, and people who are considered elderly, which by this definition is about 50 years old. And then to summarize, these are the two big groups, but the other people that are at risk besides pregnant women are other groups. And the mortality is the second most common mortality after eating contaminated food with listeria. Number one, eating the raw oysters from Vibrio vulnificus is a little higher. So here's your risk groups. All of these things are cancer patients, transplant, diabetes, kidney disease, and even iron overload and lupus. I love this picture just because if you're pregnant, you may actually have an increased susceptibility to certain things like listeria or malaria or HIV. But the other thing is you may or may not have a high risk of a severe illness if you're pregnant, and vice versa, or you could have both. So this is interesting when you look at different infections. Why is pregnancy such a risk time? Because to try to prevent your immune system from rejecting the baby, you will have internal changes where your immune system's pro-inflammatory component will be suppressed, and you will then have a immunosuppression period during the middle part of your pregnancy that will disappear after you deliver and towards the end of the pregnancy. So this is the vulnerable period of the mother, and the child's vulnerable period is the first and second trimester. Another bug that is associated with spread by mosquitoes, and in pregnancy you have a worse illness, is good old malaria. And when you have malaria, your eyes are yellow jaundice, and you have sometimes hemolysis, which makes your urine black. So they call it black water fever. You're peeing black hemolyzed urine. Here's your peripheral blood smear full of malaria inside a red cell, and those are the malaria inside the red cell. This one is the bad malaria falciparum with the banana-shaped gametocyte in a peripheral blood smear with the circles being your red cells. Many kids die of malaria because it sludges the blood flow in the brain and they go comatose and die. And on autopsy, the brain is all necrotic and dilated blood vessels, and there's the blood vessels full of the malaria, not allowing oxygen exchange. A different malaria can show up with a strange cell like this called a myrizoite. And if you see the red little dots onto the right of the cell, those are called Schuffner's dots. So you know that the malaria species is Vivax ovale, which is not as severe. Or if you have a different malaria called Plasmodium malariae, you have nephrotic syndrome where you lose protein in your urine. And when that happens, you blow up your stomach full of fluid with ascites, and you have edema, which he has around the eye. And that malaria looks like the planet Saturn. So there's many species of malaria that can infect you. The bad one with the highest mortality is falciparum. And here's a scanning microscope showing you the cells hemolyzing the red cells with malaria. Now, where is most of the malaria deaths in the world? It's actually not in North, Central, or South America to the left. It's somewhat in South Asia and India and Indonesia on the right, but the bulk of malaria deaths are in sub-Saharan Africa, which is the lower part of Africa, which is bloated, showing you how many deaths are occurring. Here's the different fever patterns that occur with the different species of malaria, which can give you a break in between fever spikes every 2 or 3 days. Here's what a patient would look like with malaria on a ventilator with jaundice or yellow skin. Here's the brain with all of the bleeding in the white area and the hemorrhage from the malaria clogging up the blood vessels. Here's the comatose child with malaria in the brain. Here's how you diagnose it. You take some of their blood, you smear it on a slide, and you do a thick smear. And yes, they have malaria on low power on the left. Then you go to high power and you look at the red cells. And yes, this one is the bad one, falciparum, infecting 30% of the red cells, which is a high level of parasites. Anything above 5% is high. You can even do a antigen test, which is quite cheap, like a pregnancy test, to see if it's Vivax or falciparum. What place has the highest risk of malaria if you travel there? The answer is Oceania, which is the Pacific Island group. Sub-Saharan Africa is very close. India is a distant third. Southeast Asia is a more distant fourth. And then South and Central America, very rare, but still possible. And then when you come back with fevers from traveling, what do you most likely have? And in this study, it was malaria dominating, and less likely other infections like dengue, etc. What should you have taken if you were going to a place where malaria is endemic? You should have taken Malarone. The second drug sometimes is doxycycline, and maybe mefloquine is your least likely one. You should also prevent mosquito bites and make sure it has DEET on it. Now, the fourth topic is, what about tick bite emergencies? Well, the big one is Rocky Mountain spotted fever, where you get a rash on your hands and feet, and it spreads inward to your trunk, called centripetal, as opposed to outward, centrifugal. And this are the spots affecting your blood vessels, like a vasculitis. And it's the big dog tick who bit you. The states with most of the Rocky Mountain spotted fever are not in the Rocky Mountains. They're actually in the Appalachian Mountains and then the Midwest in red, as you can see there. Now, if you go up to Massachusetts in the Northeast, and there's islands called Martha's Vineyard and Nantucket Island. If you visit there in the summertime, there you are waving. These little tiny Ixodes ticks can bite you, and they embed, and then they have an organism that can inject in you. And that could cause a severe illness, especially if you are immune suppressed. And it mimics malaria because it's inside your red cells, looking like dumbbells. But if you can find the classic Maltese cross in a red cell, which is in the top right, the Maltese cross, named after the island of Malta, where they have a cross that in Christianity has a thicker level to it. So that's called a Maltese cross from the island of Malta, where it was described. And again, it's found in the Northeast US and Wisconsin, Minnesota, Michigan in the mid-north area, and it's caused by the Ixodes tick, and the Babesia is the cause. Europe has a different species, and Asia has different species. Another tick bite illness is called Rocky Mountain spotless fever, because the rash is not prominent, but you have fevers, muscle ache, headache. And when we look at your peripheral blood smear, we see a monocyte with a nucleus, and then in the cytoplasm, those black little specks are called morula. So we know we have monocytic ehrlichiosis. But if we look in your blood smear and we look at a neutrophil, or a white cell called a polymorphonuclear cell, in the cytoplasm is these balls, which are, again, morula. That's called granulocytic ehrlichiosis. So you have the monocytic ehrlichiosis from the big dog tick that looks like this, or the Lone Star tick, which is also a big tick. Or you have the granulocytic ehrlichiosis, and guess what it's spread by? Good old small tick Ixodes. Ixodes is the one that gives you Lyme disease. It can give you the ehrlichiosis, and it can give you babesiosis. So you could actually have 3 bugs from one tick bite, but of course not common. So there'll be frequent test questions on what are you looking at with the arrow. You're looking at a morula, you're looking at a neutrophil, so this must be the granulocytic ehrlichiosis. And to put you back on your feet, to remember, you have to keep up with the literature. They renamed the granulocytic ehrlichiosis. It's now called anaplasma, and the species is Phagocytophilum. So in micro, they change names every 5 years. It's a real nightmare. Here's another classic story of a guy going, and he's golfing, he gets bit by a tick, and he's old, and he gets low white cells, and his kidneys start failing, and they look in his peripheral blood, and look at that, a neutrophil granulocyte with a morula. So he has anaplasmosis, or the old name granulocytic ehrlichiosis. Look where it's located, those northern mid-states and the New England area. Especially the older you are, the sicker you are. And the ticks that bite you with Ixodes are usually the nymph, which are very small, whereas the ones that you tend to get bitten from, the other ones, are more of the larger dog tick size. So the nymph is what you normally get with Ixodes, which is a smaller tick, but even the adults are smaller than the big ones at the bottom, which is more in Florida as opposed to the others. But you can get all of them in Florida, but mostly they're in those hot spots that we talked about. This is a great idea, which is this is a great slide to learn different infections by looking at a blood smear. So we already covered the malaria blood smear. We covered the Babesia blood smear. We covered the Ehrlichia and the Anaplasma blood smear. Other things you can see in a blood smear, especially in an AIDS patient, is disseminated histoplasmosis in the left upper corner. A rare disease called relapsing fever in the right lower corner is a spirochete outside the red cell, Borrelia recurrensis. Sleeping sickness is also in your blood and in Africa, bitten by the tsetse fly or tsetse fly, Trypanosoma brucei. It's outside the red cell. It's a little squiggly looking thing. And then Bartonella is another one in Peru, Ecuador, and Colombia, inside a red cell, giving you a roya fever or hemolytic anemia. And rarely a fungus, Candida, can be seen in a blood smear. And then finally, to conclude, let's talk about the gross eye emergencies, okay? So what gives you red eye or pink eye, okay? Very contagious. This is red eye or pink eye. It's caused by a virus called enterovirus. There is no treatment. It's supportive care. You're contagious for a week and you should not be around anybody. It's highly contagious. Pink eye, red eye, enterovirus. The name of the virus illness or syndrome is called acute, which means it's fast, hemorrhagic, which you can obviously the hemorrhage, hemorrhagic conjunctivitis, that's the white part of your eye. So acute hemorrhagic conjunctivitis. The second cause of pink eye, red eye lasts 4 weeks. It's a nightmare, and it can involve the cornea, and you get red eye, pink eye. This is caused by adenovirus, and it's called epidemic because it occurs in outbreaks, keratoconjunctivitis. So kerato means involving the cornea, and then the conjunctiva, the white of the eye. So epidemic keratoconjunctivitis. No treatment, supportive care. Now, this is a medical emergency. It's actually sexually transmitted. If you touch your a infected person, usually their genitals, but other parts of their body, and you get it in your eye from your fingers or whoever knows how you could get it there, but it's by contact, and this is gonorrhea in your eye. It's a medical emergency. Your eye can perforate. It's very pussy, inflamed, and this is a medical emergency called gonococcal keratoconjunctivitis. And you treat it with antibiotics topically and IV and try to save the vision in the eye. This is a herpes in the eye, which is herpes simplex. It may not be sexually transmitted, but it could be introduced by your fingers. And it looks like a dendritic ulcer. You use a special substance called fluorescein. You use an ultraviolet light, UV light, called a Woods lamp in your dermatology or ophthalmology office. Turn out the lights, make it dark, shine it on there after you put these drops in there. And now you see this root-looking ulcers called a dendritic ulcer, classic for herpes simplex. However, the cousin of herpes simplex is herpes zoster, which gives you shingles or chicken pox. So this is shingles in your eye with the dendritic ulcer. And usually with shingles, you have the ophthalmic division of the fifth nerve called the trigeminal, supplying sensation to your nose tip and your eye and forehead. So this would be called the Hutchinson sign because the nose tip is supplied by the nasociliary nerve, which also supplies the eye. This is your retina with CMV retinitis. You can lose your vision from that. Usually you have AIDS or lymphomas or immune suppression. This is a really bad one called shingles in the eye or herpes zoster retinitis. It's called PORN, progressive outer retinal necrosis, where it likes not the middle of the eye, like CMV, right where the optic disc and the blood vessels come out, the middle, when you're looking at the back of the eye. You actually see it in the peripheral eye, away from the middle, and it's called progressive outer retinal necrosis, and you usually have it in your brain and die of encephalitis. And again, you're usually immune suppressed, AIDS, lymphoma, et cetera, transplant. Now, if any of you use contacts, please clean the liquid. There's 3 infections associated with contaminated contact lens liquid. So when you put it in, make sure you're putting sterile stuff in your eye. One rare incident was a outbreak from the drops of Renew came to you contaminated with a fungus. So when you get an eye infection, you can lose your vision. This is the classic water bug Pseudomonas aeruginosa in your eye. It's a gram-negative rod. It grows on the agar plate as a mucoid-looking colony. A rare cause of blindness from water bugs are the amoeba called acanthamoeba, which is the arrow there. And the third one is if you get a splinter cut in the grass or something hits your eye, you can lose your vision from a fungus in the soil called Fusarium. And that's what it looks like. And this was the famous outbreak from Fusarium, the fungus contaminating your liquid that's supposed to be sterile. So the top three causes are Pseudomonas, acanthamoeba, and Fusarium. And this is what pus in your eye would look like, called a hypopyon, with pus down at the bottom. This is a periorbital cellulitis, where your eyelids are swollen, but you can still move your eyes. It's on the outside of the orbit. This is the more deadly orbital cellulitis. It's in the muscles around the eye. It's in the orbit, okay, the bony thing that holds your eye, and you can't move your eye because you have paralysis. Your eyelid is paralyzed, and this is what it would look like. So we're out of time, and we want to save time for questions. So I'm going to skip the parasites and the protozoa missions. So actually, this will be fast. The one parasite you can have if you're immune suppressed, it can live in your intestine for 80 years. You get chemo, steroids. It takes bacteria from your stool like E. coli, brings it into the lung. It migrates throughout your body, causes pneumonia. And when we cough up some spit, it migrates all over the agar. And those little white colonies are normal mouth bacteria, but the little worm is carrying the bacteria as it crawls on the agar plate, and it looks like a pearl necklace. It's 1/4 of a millimeter long, and it's called Strongyloides stercoralis. And there's the syndrome with the pneumonia, the E. coli in the blood, the immune suppressed AIDS with Strongyloides stercoralis. And if it migrates in your skin, it's called larva curans in a straight line. And it would look like that. Now, I'm really going to stop now because I'm out of time. So I'm going to skip the GI emergencies. And
Actually,
we
Dr.
covered
Greene,
that.
I just wanted to say if you would like, you can take your time on those because we usually go over an hour unless you have to step out. But we're good on our end if you want to
Okay,
continue.
good. I will keep going and give you a little more time. Okay, so
Okay.
let me do the GI illnesses. So when someone dies of dehydration and they have diarrhea and they acquired it in a dirty area and their stool looks like rice water stool, it's not have blood in it. It's a curved gram-negative rod which has motility. It's the cousin of Vibrio vulnificus, which we talked about in salt water. This one is called the more famous one called Vibrio cholera. Everybody's heard of cholera. Interesting, the history of Vibrio cholera is that they believe it started in Bangladesh, which would be eastern Pakistan. From there, it spread to the Middle East. From the Middle East, it spread to Europe. And from Europe, it crossed over to Central South America. And the infamous outbreak of cholera, you have to lay on a bed with a hole in it or a mat and a bucket under you because you can't sit on a toilet. You'll pass out. You're dehydrated. It's pouring out of you. So this is the Haiti epidemic where they had people dying of cholera in Haiti. And this is the tent, and you're laying in this bed with a hole in the bed and a bucket underneath it to collect the stool. And this is where it hit Haiti the worst in the darker colonies. And this is the outbreak publication, and it came from a different strain than the one that normally lives in the Gulf of Mexico. They traced it back to way over there on the right. It actually came from Nepal, which is right above India, not in that box there. And then Nepalese soldiers were UN soldiers had cholera colonization, and they got it. Their sewage got contaminated in the rivers, It was a Nepali strain, different than the Gulf of Mexico El Tor strain. So the population in Haiti, in the box on the left, was not recognizing that strain, and they had a big outbreak, and a lot of people died, showing you how immunity may be only for certain local strains and not global world strains if you survived cholera in the past. The famous guy who's called the father of epidemiology, you should study this, I love history. He noticed that looking at a death map, people who died in the city of London in 1850s, they all seem to cluster around a district in London called the Soho district, Soho. And he figured it out that, hey, it's not spread by the air, which is the miasma theory, it's spread by water. So he has this new theory. Everyone thought he's crazy. They don't accept it for 10, 20, 30 years, but he proved it by a simple study. He went to the well where people in Soho get their water. He takes the handle off the pump. So now you can't get water there. So you have to get water elsewhere. And he stops the epidemic. Guess where that water well is? It's in the 40th Street of London, England. And if you go there today, no joke, today, right where those guys are leaning against is the famous pump where John Snow, the famous epidemiologist, proved that it was by water spread. And even on the corner of that street, they recognized John Snow and they named the John Snow pub right on that corner. And you can read plaques there that tell you about how he stopped the cholera outbreak in London to this day. Now, another diarrhea bug that is real dangerous. It causes blood in the stool, unlike cholera, which does not. And it can ulcerate your ileum, small intestine, and your cecum, large intestine. And when it does, it can perforate, which you die of peritonitis. And if you get red splotches on your body, we call those rose spots. This is Salmonella typhi or typhoid fever. If you go to endemic areas, you can get a typhoid vaccine, by the way. Here's a guy that died of typhoid with multiple surgeries, and he developed fistulas because the stool was burst into his belly and he couldn't be saved after multiple surgeries. And you are very malnourished. If you go to surgery, here's the holes in the intestine with all the holes from typhoid in your ileum. So you cut out those whole area where it's all damaged and then stick it back together. And this is a true story of a guy who spends time in Togo, Africa as a surgeon to help the locals for a month or two in his career. And they are having typhoid epidemic. So this young girl has been sick for 3 weeks. She has perforated typhoid, and he operates on her several times. You should check out how other countries' hospitals work. The family literally has to come in with the kid and feed the kid and sleep with the kid and take care of the kid. It ain't like a pediatric hospital here. And so the whole family's here, usually the mother, and taking care of the kid. And the kid's here for like 6 weeks. And the kid survives. There's the surgeon. It's time to go home. And the kid is now living happily after this highly chance of dying kind of illness, perforated typhoid. And this is what she looks like. Now, you don't have to leave the state of Florida to get typhoid, but of course it's very rare. So here's a rare outbreak. In the Miami area, they were selling smoothies made from different fruits that come from Central South America. This one happened to be a fruit called mamey, and the fruit was contaminated in a frozen concentrate with Salmonella typhi from Guatemala, Honduras. And guess what? People in Miami, Florida are getting typhoid fever, and they traced it to the frozen mamey, which came from Guatemala, Honduras, and there's the famous outbreak. Again, rare, but things happen because we get food and fruits from other countries, and if it wasn't prepared to standard. Somehow it was contaminated with stool. That's where Salmonella typhi lives. As gross as that sounds, it wasn't clean. Cleaning hands, handling the mame frozen concentrate, somehow it was contaminated. Okay, kids going to the petting zoo, very rare event, but this is why they should wash their hands, because they could get a life-threatening illness from the animals called E. coli enterohemorrhagic, where their blood hemolyzes and their kidneys fail. That's your glomeruli in your kidney, and there it is there. And this is actually associated with not an invasive infection, but a bug that sits on the surface, and eventually in 3 days, your diarrhea goes from watery to bloody. You don't want to give them antibiotics, or they could get the dreaded HUS. What does that stand for? Hemolytic uremic syndrome. What was the famous food item that was first discovered causing this? It was the hamburger. And which strain of E. coli was it? It was the 015787. And remember, in a slaughterhouse or a meat packing area, when the cows are killed, one steak comes from one cow. So you're not likely to get infected eating a steak. However, all the leftover meat from the 100 cows killed that day gets thrown in a vat, and that's where hamburger comes from. So you're much more likely to get infected by hamburger. Now, let's say you're vegetarian. You can still get this if you're a vulnerable kid or immune suppressed, or for some reason genetically you're predisposed to it. This was a different strain of hemolytic uremic syndrome from an E. coli in Europe that was associated with a different serotype, and it was actually vegetables was causing it, because remember, what do they use to fertilize the food? Animal manure, like cow manure, and then of course the water in the fences where the cows live, and the vegetables are not very different, and so you can get contamination of the fruit from these bugs. So it can also occur if you're a vegetarian. Now, we have officially finished, and I'll be glad to take any questions that anybody has. Thank you for listening to me, and I will exit and stop sharing.
Awesome. Thank you so much, Dr. Greene. I really learned a lot and I enjoyed your session. I know the audience and I really loved hearing about such a wide variety of topics, such as like an insight into your career and how like different it is every single day. We also enjoyed seeing the entries in Kevin Carter's diary because it's a really good reminder of the human side of medicine. So I'm
Yes.
just going to ask a couple of questions here we have from the chat. Our first one is, how do you distinguish between a routine animal bite from the onset of something more severe like capnocytophagia sepsis?
Yeah, so obviously most people are not going to be a risk group of having severe illnesses, because we get plays, our animals play with us, and it may be break the skin sometimes. And if it's a very minor scratch from their teeth, it's not a big deal. If it breaks the skin is deeper, then when and if to use antibiotics depends on how deep the puncture is. And then when they catch this early enough, they can actually treat it and keep it from happening to develop into septic shock. But if you're in a high risk group, then it's very important you get care immediately and get put on treatment before it's too late and you become septic, which are what those pictures show of the extreme worst case scenario, which occurs maybe in 1 in 10,000 or more bites. So the vast majority of the time, it's not as bad as what I showed. I just give you the worst of the worst.
Got it. That makes sense. Um, Thank you. Our next question is, based on your mission trips that I mentioned in the intro, what is the most critical change that you think is needed to reduce pediatric mortality in those regions that you visited?
So the biggest thing that is always used by people in groups that go to places that are very rural or poor is to make sure that their water supply comes from a sterile well area, and they separate the sewage from contaminating the good, clean water. which, by the way, in London, I didn't mention this, but it's an interesting fact that when John Snow was investigating the cholera outbreak in London in 1850, what happened was the sewage pipe under the ground had ruptured near the water cistern in the Soho district, and raw sewage was leaking into the clean water. So that's a perfect example of an illness when you don't separate clean water from contaminated water. And so the first thing they do is clean water, separate it from the cisterns of toilet water and things like that. And then, of course, preventing insect bites, mostly the mosquitoes, are the big thing, whether you sleep under a net to prevent the mosquito bites. So there's simple things that can be done that are fairly not expensive that can help amazingly hit populations like that.
Yeah, that's very interesting. You definitely have to hit the root cause of all these problems before being affected with the illnesses.
Yes.
Let's see, our next question here. Students were interested to know what has been the most rewarding part of your career?
So the most rewarding part of the career is when you help people out that are navigating a area they're very unfamiliar with, such as a cancer diagnosis or a life-threatening illness. You, as a medical person, have seen this played out hundreds of times, and you know the probability that this will happen or that will happen. And then you can give them honest answers to what is happening in prognosis, but you can also emphasize the positives. And the worst thing anybody could ever lose as a patient, which was illustrated by a physician who died of cancer, he said, the one thing that kept me going is I always had a sense of hope. Once you lose hope, you are done with it. It's like it's over, no hope. Now, that hope, everybody's going to die, obviously, right? So your hope could be, well, after death, I feel very strongly I'm going to be living in heaven and all these things. So your hope can actually be outside of this life, or it could be hope I'm going to spend the last days of my life with my family, and things will be as calm as possible, and any discomfort will be alleviated, whether it's hospice or not. So don't ever let people lose their sense of hope, even when it's like bleak. Maybe there's something you could say that's a positive. It's very hard in the last days of life, learning to find something positive to say, even if it is, I care, I'll be thinking about you, I'm available if you need me, anything positive.
That's very inspiring. Yeah, we should all strive to be the most like reliable and just open people we can be as we venture into this field because I believe physicians are like the most trusted personnel in a person's life, so we should always be open and being able to be that shoulder for people in
Right,
times of crisis and good times, of course.
right.
Let's see. Our next question is, given you wear multiple hats in academia, research, volunteer work, how do you manage your work-life balance and like what do you like to do for fun outside of work?
Yeah, great question. By the way, I do tons of extra things besides taking care of patients. So whatever field you go into, you may have a interest in certain subfields within your field. So for example, I do infection control where I help people understand how to prevent infection spread in hospitals. I also do a antibiotic stewardship, which means how to give antibiotics correctly and supervising pharmacists. And I could go on other subtopics. So that is the important thing. And then also important is you don't want to burn out, and you don't want to be a lone ranger where all you do is work, work, work. No one sees you. Everything is work. You have a life outside of work, usually a family of some sort, and you want to spend time with them because who's going to be at your funeral is rarely going to be a few people from your work, but it's going to be the people who you are around family wise. So you want to spend time with them, and this is a demanding job. And whoever winds up getting married, if your spouse is not in a medical field, they I'm sure they know you're getting potentially into a relationship with someone who's not going to be as available because the job is so demanding, but that doesn't mean you'll never see them. So you need to have a nice work home balance, enjoying your family and enjoying travel and vacations and enjoying things you love to do, whether it's reading, teaching, religious observations, you name it, you could do it. And you just need to make the time for it and learn to say no to doing too many things.
Agreed. Thank you so much. Thank you so much for the advice, Dr. Greene. We really appreciate you sharing your stories and giving us such a great look into your career. I'd love everyone to please give a warm thank you to Dr. Greene in our chat box for this incredibly informative session. Thank you so much.
Well, thank you, Amna, and thank you, Asima, for letting me talk to the group, and keep doing what you're doing because you're making a difference.
Thank you so much. Have a great weekend.
Take care. Thank you.
All right. Now we're going to conduct our closing session with our quiz and future session dates. So the link to the quiz for this session is now live, and you'll need a 70% or higher to pass and receive certification. That's teleshadowing.com/certification. And our future session dates will be posted throughout our social media outlets, so be sure to follow us at TeleShadowing. And thank you so much, everyone, for attending today's session. We hope to see you in upcoming sessions as well. And this concludes this week's shadowing.